right? Thank you very much. Once again, welcome to Midwifery Jigsaw, the TV show in which every week we try to give answers to some tricky midwifery cases. Right. This week we have received the case of a 46-year-old lady called Amy, who suffered from eclampsia when she was 27 weeks pregnant. Many people wonder what eclampsia is. Is it not an hypertensive disorder as well as preeclampsia? Really high blood pressure plus other signs such as proteinuria?
Yes, it is. Eclampsia is severe preeclampsia complicated by tonic-clonic convulsions. It's associated with increased risk of maternal and perinatal morbidity and mortality. Main maternal complications as a result of eclampsia include disseminating intravascular coagulation, pulmonary edema, multi-organ failure such as cardiac, renal and hepatic, HELLP syndrome, brain hemorrhage and cerebrovascular accident.
Yes.
That can persist later in life.
And it has as well complications for the baby.
Yes, it has. Yeah, it has also significant complications for the baby, such as IUDR, placental abruption with its subsequent hemorrhage and oligohydramnios.
It sounds bad, doesn't it? Well, thankfully, the good news is that it is a very rare condition in developed countries, with an incidence of 2.1 per 10,000 deliveries. It is more common in the last trimester of pregnancy, although it may occur at any time during pregnancy, in the antenatal, intrapartum, and as well in the postpartum period. It is normally preceded by preeclampsia, but it can also happen without any previous signs, in which case it's called fulminating eclampsia.
Oh, interesting. The next video shows a next scenario where a midwife and a student midwife discuss the therapeutic interventions that are essential in taking care of a woman who suffers from eclampsia.
Alright,
Let's watch it.
okay. They're lovely.
Morning, Hilary!
Hi, you're right.
Yeah, and you?
Fine. I have just come from the handover and I'm having a look to our patient's notes.
Right.
She's called Amy. She's in room 18. She's 27 weeks pregnant, has suffered an eclamptic fit whilst preparing her for an emergency C-section.
Bless her.
Yeah. Do you know something about eclampsia?
Yeah, well, kind of.
What do you think we need to consider in this case? Like basic things.
Yeah, well, I think in this case, if she's already had a seizure, we should stabilize her first and then prevent it to happen again.
Yes, it's completely right. So, broadly, we could say that the management of an eclamptic woman consists on giving her first the anticonvulsant therapy. As we can see here in her notes, they have used magnesium sulfate.
Right.
So this is the most used anticonvulsant. As well, we need to treat the hypertension. She has had as well labetalol. She needs a strict control of fluid balance. Have you heard something about fluid balance? Really important in these cases. As well, maternal and fetal monitoring.
So in this case, we should check the vital signs and fetal heart rate, for
yes,
example.
and as well, you need to remember about the neurologic stages assessment of the woman. In this case, it's really important. Okay, with these medications.
Right.
And something we need to consider as well is that the only definitive treatment for preeclampsia and eclampsia is the delivery. So this is the reason why Amy has gone for a C-section, even though she's under 27.
Right. So is section always recommended then?
No, it's a really good question. So if the woman is stabilized, the preferable way of delivery is a vaginal birth.
Right.
But this is not exactly the case, and we should always base this decision on obstetric indications. So a C-section may be considered if, for example, an unfavorable cervix, or when there is a gestational age equal or under 30 weeks.
And why is that?
Yeah, this is because an induction of labor under these circumstances may result in a prolonged intrapartum course, obviously, and is frequently unsuccessful in avoiding the C-section, which means that she may end up having a C-section anyway, and we have only done things longer. And this is as well because of the high rate of intrapartum complications in
Right,
these cases.
so Hilary, I've been having a look through Amy's notes and I've seen that she's having general anesthesia. Is it always the case?
No. Again, if the eclamptic woman is conscious and she's hemodynamically stable and cooperative, which is not Amy's case, we should go for an epidural, which is the preferred pain relief method. And this is really important because in these cases, the pain relief really aids to control the blood pressure. So what we need to know here is that in order to have an epidural, it is mandatory to perform a platelet count,
Right.
which should be over 100. And as we can see here in the results, we see that Amy's platelet count has dropped
Right, 70.
70, yes. So this is the reason why she needs to go for a general anesthesia.
Okay, so I see. I understand symptometry can be used to induct labor because of its hypertensive effect.
Exactly.
So what about the third stage then?
So what do you think we could give her?
Well, we should just use oxytocin instead of symptometry. Okay.
Exactly. You've got the answer.
So shall we go and see her?
Yeah, exactly.
Good morning.
Are you alright with this?
Yeah.
Okay.
Thank you, Hilary. Well, as we've seen before, the midwife has explained to the midwife that the therapy of choice to control seizures is the magnesium sulfate. It can be used either to prevent or to treat them, and it's recommended by the World Health Organization.
This is right. They recommend a intravenous regimen which consists on a 4 grams loading dose by bolus or infusion pump over 5-10 minutes. Then 1 gram per hour, infusion maintained 24 hours after the last seizure or 24 hours after delivery, whichever comes the last. And it needs to be followed by 2 grams bolus or increase infusion rate to 1.5 grams or 2 per hour if there are subsequent seizures.
Yeah, and finally, if convulsions persist, the intubation may be necessary. In this case, we will need to liaise with the anesthetist and the obstetrician if this continues.
Sure. So there's something else we need to bear in mind when talking about magnesium sulfate, and it is its toxicity. Magnesium sulfate contains aluminium, which may cause toxicity if there is excessive dosage of this medicine, or as well in cases of renal failure. So there are some basic things that we need to assess and to monitor in a lady that is having magnesium sulfate. To start with, we need to do a strict fluid balance.
Yeah, indeed, because magnesium sulfate is excreted in the urine, so it's necessary to monitor the urine in an hourly basis. If the urine output is less than 20 ml per hour, then we should stop the infusion.
Exactly. Something else we need to assess are the reflexes. Reflexes is the first thing that we will detect that a lady is losing in case of toxicity, especially the knee jerk, patellar reflex or knee jerk reflex.
In this case, we also need to take into account the signs and symptoms who are also similar to the preceding symptoms of an eclamptic fit, which are nausea, hot flushes, confusion, weakness, blurred vision, and slurred speech.
Exactly. And finally, we can't forget the main sign, the main assessment, which are the vital signs of the woman. We need to control them, to assess them really
close.
Yeah. So we need to observe the blood pressure, oxygen saturation, temperature, pulse, and respiration, right?
Yeah, well, respiration is very important to take into account because we need to monitor it hourly. Because if it's less than 14 breaths per minute, we should stop the infusion. And if the oxygen saturation is less than 95, we should also stop the infusion. Because it can cause respiratory depression.
Exactly, and of course, the more straight way to check the levels of magnesium in blood is doing a blood test.
Yeah, we need to do a blood test 1 hour after commencing the infusion, and then it has to be repeated 6 hours later. The therapeutic range is between 2 and 4 millimoles per liter.
Exactly. And well, if suspecting a lady can suffer from intoxication of magnesium sulfate, what should we do? First thing, basically, is stop the infusion. We need to stop the infusion and perform further
Investigations.
exactly,
Yeah.
such as blood tests. And in case it is confirmed, then there is antagonism.
Yes, a counteraction of
exactly.
magnesium, which is called calcium gluconate.
And we have to administer it.
Alright, so far we've seen the general management of eclampsia, but it's very important for the midwife to recognize signs and symptoms preceding an eclamptic fit, both for detecting woman's risk to have a seizure and for the first time, and to detect the risk of recurrence.
Exactly. Some of those symptoms have already been described in Amy's case. She had been feeling unwell for the last few days, suffering from headaches and sickness, and had upper abdominal pain, like heartburn, that wouldn't go away with any treatment. Apart from them, there are other signs and symptoms, such as blurred vision. So the woman might report that she can see some spots, confusion, generalized edema, irritability, and disorientation. Further investigations, such as blood tests and a physical examination, may reveal abnormal liver enzymes, marked proteinuria, tender liver, platelet count falling under 100, and HELP syndrome.
Yeah, well, in Emmy's case, blood tests repeated 6 hours after admission showed her platelets had decreased from 165 to 70. Her HB had decreased from 16.3 to 15.8, and her ALT and bilirubin had increased.
Right. Since the main characteristic trait of eclampsia is the presence of seizures, it is of vital importance to know how to act before a seizure. Therefore, from now onwards, we're going to focus in the eclamptic seizure, its status and management.
Yeah. To start with, it's important to know the different stages of the fit and how long they may last. It basically consists of 4 stages. The first stage is called the premonitory stage, which may last from 10 to 20 seconds. In this stage, the eyes roll or stare, and the face and hand muscles may twitch. The second stage is called the tonic stage and can last up to 30 seconds. In this stage, muscles go into violent spasm. We can observe clenched fists and rigid arms and legs. In this stage, the diaphragm is in spasm, and consequently, breathing stops and cyanosis appears. The back of the woman may be arched, her teeth may be clenched, and her eyes may be bulged.
The third stage is called the clonic stage. It lasts from 1 to 2 minutes. In this stage, we may see violent contractions and relaxation of muscles, increased saliva, which causes the common foaming, a deep, noisy breathing, and a congested and swelling face. And the fourth and last stage is the coma stage, which may last from minutes to hours. In this stage, the woman is deeply unconscious and often breathes noisily. The cyanosis may fade, but the face is still swollen or congested, and further fits may occur in this stage. Management of a seizure.
Now we are going to explain the management of a seizure. If we are walking on the street and find a pregnant lady who is having a seizure, it's important don't try to stop it. Instead, we will place the woman on a lateral position like this. If we are in hospital, we will use a Gettle tube to avoid tongue bite, and we will perform suction of oral secretions. We will also administer oxygen by mask at 8 to 10 liters per minute. We will also elevate bedside rails to avoid accidental fall from bed. And finally, we will administer magnesium sulfate to control fits. It's important to remember that the woman might require high dependency care, as she might remain comatose for a time following the seizure or maybe sleepy.
And now let's talk about the postnatal period when taking care of an eclamptic woman. And we can't forget to briefly talk about the postnatal period. As we all know, the postnatal period is considered the Cinderella of the maternal services. And regarding preeclampsia and eclampsia, we need to remember that although in the video we have seen that the midwife explained to the student midwife that the definite cause for preeclampsia and eclampsia is the delivery, which is true. In the postnatal period, it can also occur. And usually the blood pressure falls after birth, but it can increase as well after 24 hours post-delivery. So we really need to keep a close eye to the women's blood pressure.
Yeah, well, according to the Royal College of Obstetricians, it's important to know that up to 44% of eclampsia occur postpartum, especially at term, and it has been reported up to 4 weeks postnatally, although the incidence falls dramatically after the 4th postnatal day.
Right, this is all for today.
Yeah.
Unfortunately, we have run out of time and we need to start saying goodbye.
Yeah, we hope you've learned a lot and enjoyed this case of today. We hope to see you next week.
Yes,
Every Friday,
9 a.m. in
Midwifery Jigsaw!